14 doctors and nurses from Strong Memorial Hospital and other medical professionals just returned from the heart of the fight against COVID-19 in New York City. They spent nearly a week at Northwell Health's North Shore University Hospital and Long Island Jewish Medical Center treating COVID-19 patients. Kayla Green talked to some of them today about their experience in the state's epicenter of the COVID-19.
Doctors and nurses from the emergency department here at Strong say walking the halls of the hospitals in New York City was intimidating at first. But they say once they got to work, it was inspiring to see everyone working together in such a difficult situation. Helping downstate hospitals during the COVID-19 pandemic is something Jesse Schuff says he'll never forget.
All the spaces that they had available to see patients were full much of the time, and the acuity level of patients, meaning the degree of their illness, was very high.
Dr. Ekta Andrea McGlaney says seeing how these hospitals have adapted and changed their practices gave her ideas she's bringing back home to Strong. But she says the situation there is on a whole other level than it is here.
So they don't necessarily have COVID centers, but what it comes down to is even if you're coming in for something other than being COVID related, you likely have COVID also. So there's really no such thing as a patient that doesn't have COVID at this point.
Dr. McGlaney says she never saw anyone denied or without PPE.
Once people were in the thick of it, they recognized that we are protected and they were able to not have to worry about it, roll up their sleeves and get to work. There are certainly conservation efforts that are happening, but I think it's all been appropriate and their staff is well protected.
She says here in Rochester, we have the benefit of having space. She says she can't stress enough to keep following the rules.
This is a marathon. This is not a sprint, and everything that we can do, and we're reaping the benefits in the Rochester community from everyone practicing social distancing.
There's another team of 14 medical professionals from Strong who are still downstate and are staying to help out there for another week. In Rochester, Kayla Green, News 8.
All right, thank you, Kayla. Doctors also say they saw the importance of keeping patients connected with their families, albeit through technology, and the impact that had on their care.